Welcome to the D&D Fitness Radio Podcast, brought to you by your hosts, Don Saladino from New York City and Derek Hansen from Vancouver, Canada.
How are you?
Dr. Greenberg, how are you?
Good. Nice to meet you.
Awesome.
Finally.
Finally, yes, I heard great things. And where are you located out of?
So I'm in Bryn Mawr, Pennsylvania. Do you know where that is? Like the main line?
No, I do. I spent some time in PA, but I'm just not too sure. Thank you. I'm not too sure about,
like Western
area.
Philadelphia suburbs, like Villanova.
Okay.
I'm sure you heard of Villanova.
I've been to Villanova. Yeah, I've actually been there. I had some friends who went to school there, and spent some time. That was 100 years ago. So.
I live in Villanova. And Bryn Mawr is just like one town over, and that's where the hospital is that I practice at. So, all
right.
Yes, it's a really great place.
No, God, I haven't been to PA in a while. Derek, have you been to Pennsylvania? Derek, did you get a haircut? Why does your hair look different? I'm wearing a hat because I'm a mess.
I have not had a haircut, so it's like it's quite long. So I'm just gonna I can actually style it now, I guess. So. But I actually watched the Villanova Georgetown game like a couple of weeks ago because they replayed it, the Final Four game. So that was kind of cool.
Yeah, it is cool. They've always fielded a pretty good team.
Yeah.
So Jay Wright's a really good coach.
I love it. So listen, just a little quick intro on Dr. Greenberg. All right. So Derek, Dr. Greenberg works with high-profile athletes, helping them stay healthy and healing injuries. Dr. Greenberg, you specialize in holistic and comprehensive approaches to sports medicine.
Yes, I do a lot of PRP and stem cell work on patients and something called prolotherapy, basically trying to rebuild their joints naturally using the immune system. So, I deal with athletes and people with chronic pain and arthritis and all those problems. So,
Well, that sounds pretty exciting. And you've worked with a lot of professional sports teams. I mean, what I was reading earlier with the Philadelphia Flyers, the Eagles, the Phillies, obviously a lot of Philly teams, Baltimore Ravens, I think the Niners. Who else there?
I have one guy who was on the Patriots. Yes.
Okay.
And also, I don't know if you follow gymnastics at all, but Laurie Hernandez, who was on the Olympic team, the Simone Biles, she was my patient. And when they said that she couldn't compete, thank God we fixed her up so she could actually compete and make the Olympics. And it was before the Olympic trials, and she had an injury in her leg, and they never thought she'd get better. Wow. So they thought she was out. And instead now she, competed, she got a gold and silver, and it kind of launched her career, which was pretty cool. So,
Derek,
I do that.
Sorry about that.
I'm sorry. That's okay. I do a lot of that, and I know all the nutrition stuff, and we use IV therapies and things like that also. What do
you focus on nutritionally for a lot of these athletes?
Probably like intravenous vitamins and things like that to really give them a big boost of, C, B, magnesium, things like that. So obviously good diets is very important.
I'm big on IVs. I was using them for a while. I actually had an IV company working out of the gym I own in New York City. It's really more of a performance-based facility where we have PTs and we work with a bunch of surgeons up at HSS. And it's kind of this whole integrated approach to, it is more probably similar styles of training that you're really, exposed to with a lot of your athletes. But I saw some incredible results using it. And even when people would be traveling and they'd start coming down with a cold, and just being able to, get some good fluids into them and get some good vitamins into them through the vein was just so beneficial. But I still feel like some people always are like questioning it. Like, does that really work? Can you break that down a little bit?
Yeah. Hey, listen, even for coronavirus, they were looking at IV vitamin C, and they were using it in China, and some doctors are using it in Virginia and in New York also. And they've seen some success with using what I'm going to call is relatively small doses of IV vitamin C. And we may feel comfortable giving people 15, 20, 25 grams of IV C, and they're using maybe 1.5 grams every few hours. And it may not be sufficient to do what it needs to for these patients with coronavirus. So, but it's something that's shown some benefit in small studies. It hasn't been studied extensively, but they really need to look at it a little bit more and see if it's helpful, both as an anti-infective and also as an anti-inflammatory. So because it seems like with the coronavirus, there's a lot of inflammation in the system. The vitamin C may help to decrease some of those inflammatory cytokines, which are chemicals that cause inflammation.
They were saying there's like the doubled incidence of stroke they've noticed just because the inflammatory
hypercoagulability.
Yeah.
Because people are, when they get into this system, this thing called ARDS, your whole body shuts down and it becomes hypercoagulable, which means your blood clots extra quick. And then if that happens, then yes, you could have a stroke. So, the funny thing is, Don, by the way, in regards to IVs, and it's pretty funny because Trump is being ridiculed right now with what he said last night about the IV light and disinfectants and everything else. And, I'm not, political for him or against him or anything else, but it's funny because what he said in my world is actually a little bit true, that if you use ultraviolet blood irradiation, which is not really practiced very much at all.
Can you explain what that is to a lot of our viewers who don't understand?
Well, basically it's taking the blood and passing the blood through an ultraviolet light. And that's been shown to activate the immune system and also kill viruses. And the other thing that's also really controversial, which is, it is a disinfectant, is using intravenous ozone, where basically the blood's taken out of the patient, the blood's ozonated, which essentially is some ozone and a lot of oxygen. And that oxygen and ozone combination acts as a disinfectant. And then it's reintroduced back into the patient and helps to oxidize the system, which is anti-infective and also immunomodulatory, helps to modulate the immune system and reduce inflammation.
How long does that process take?
Oh, only about a half hour for a treatment.
Oh, it's not a big deal.
No, not at all.
Sounded like it was just his language was not very appropriate around it. And he was trying to interpret information given to him, and it just didn't come off well. So
I didn't see it, so I got to go back and watch it.
Yeah, I don't think it came off well either. But it's kind of funny because there was a little bit of truth to it, but now everyone's pushing Clorox tablets and Clorox IV, so which is probably not going to be good for anyone.
Yeah,
eating Tide Pods. Yeah,
exactly.
I got a question for you. So about the coronavirus, because this has been obviously the topic for the last 6 weeks. We brought out a few doctors, and we're discussing the immune system, and we're discussing the detoxification process. Do specific detoxifying, tools, do they work? Things like, infrared saunas, working out, sweating, these are like natural detoxifiers, right? Like hydration. Like, are there specific things that is it just about getting the immune system as resilient and strong as possible, and that's going to give us a better chance? Or is it just, listen, you're going to catch this thing if you come exposed to someone, and if your immune system's stronger, you're going to have a better chance of, not getting the crap kicked out of you.
Mm-hmm. So that's a really good question. And, with saunas, they have looked at what's coming out of your sweat with a sauna. And we believe, again, the studies have been small, but we believe that you will get more of an excretion of heavy metals from an infrared sauna than what you would otherwise. Now, the thing is also, you mentioned hydration. If you don't hydrate afterwards, then you're going to deplete your immune system. So you have to be able to balance out the detoxification with the hydration. So other things that may detoxify, like cilantro and juicing with celery and things like that, may be somewhat helpful. But, even if you look at cilantro, the amount of heavy metals that cilantro can pull as a chelative agent compared to certain, medical chelators is small, but probably helpful. I think a few things that are really important for the immune system. Number one, sleep. You have to have good sleep in order to help your immune system. Number two, not too much alcohol. Because too much alcohol, if people are home drinking a lot all the time, it's going to suppress your immune system. And, I think nutritionally, people really have to follow a anti-inflammatory type diet, which would be, reducing processed foods and sugars and fried foods and fatty foods, and staying with a lot of whole foods, fresh vegetables, leafy greens, and even things like mushrooms. There are certain mushrooms which are medicinal in nature, like shiitake and maitake and reishi. And these mushrooms, if you have them, they help to increase your T cells, which is a type of white blood cell that fights viruses and cancer cells.
Have you received any studies on those mushroom powders, right? Like, have you heard of the Four Sigmatic, the mushroom, they're almost like mushroom teas. And I'm hearing that they're pretty powerful from an immune system standpoint. I know a company that's one company. A company that I love from a hydration standpoint is this company called Halo Sport. And I love it because there's so many crappy energy drinks out there, but because of the sea salt, the magnesium, it really is. And I'm sweating 2-3 times a day because one, I get my own workout, but I'm doing live workouts for everyone out there right now. So am I training too much right now? 100%. I mean, but I'm supplying people with a service, and it is what it is. So for me, hydration and recovery is huge. That's interesting about the mushroom, but what also about, like, I'm hearing things about sea salt, magnesium. You know, I mentioned that company, Halo Sport. You know, I just didn't know if you had any thoughts on that.
Well, listen, I think Halo is a great product also, and I trained today as well. I did my cycling and I did some boxing because I think training is a great way to stay in shape. But, you know, products like that are really good because, number one, they don't have sugar. And, you know, comparing it to something like a Gatorade, you know, it's full of sugar, and I think it's really bad for the immune system, even though it might hydrate you. But, you know, you want to keep your body hydrated because it does keep your immune system healthy. Magnesium helps to stimulate the immune system also, and is also good as well in the times that we're going through, just even because of stress. You know, magnesium helps to keep your blood vessels open, helps to relax you and calm you. And it's really an important cofactor with a lot of different cellular reactions in the body. The other thing that I think that's important is having the B vitamins also in a hydration drink. And, you know, those B vitamins are really important as well. And the added electrolytes in order, again, to keep your immune system healthy. So Derek, I think they're really important.
No, super, super important. Derek, do you have a question before I went on to my next thing?
Yeah. I have a significant interest, I'll say, Doc, with what you're doing with PRP and other orthobiologics. Like I work with at a PT clinic where they're promoting these things, and we find that it's difficult, even with the general public, education wise. I think there's a lot of studies that are conflicting. I don't think, you know, maybe there's a lot of standardization around how this is done in terms of like how they draw the blood, they spin it, and how, you know, even just the process around like the nutrition and the rehab following an injection. So I just wanted to get your impressions of that and how you're doing it, because I think we want just more information on how we can get people to do this, get doctors on board for referring this, and even getting coverage. In Canada, they've stopped all stem cell use at this point. So we're pushing PRP and other orthobiologics at this point, but certainly PRP is one of our focuses.
Right. So I think that's a really interesting topic. And to me, you know, I see this as artistry. I've been doing these procedures for 21 years, and it's what I've been doing day in and day out. So thank goodness I have a reputation for this. And, you know, as Don mentioned, you know, I take care of a lot of pro athletes, and people from around the world come to see me for all their different problems.
Can you explain platelet, before we jump into that, I'm sorry to interrupt, can we explain what platelet rich plasma is? I think a lot of people don't necessarily know. Sorry about that.
No problem at all. I think that the easiest way to explain PRP or platelet rich plasma is essentially taking out the patient's blood and taking the platelets and growth factors and healing factors out of the blood and using that in an injection and putting it into a damaged area to stimulate the body to heal that damaged area. That's essentially what it does and how it works. So, you know, you brought up a few different points, Derek, with, you know, with the concentration of the platelets and how it's spun. I don't know if that's really the biggest issue, because I work with my biotech guys behind the scenes on this, and I don't think that anyone really knows the ultimate concentration for each person. And I think each person is actually a little bit different and depends upon the strength of their immune system. The other thing that I will say is that this is kind of like artistry, to where I think that the doctor who is performing the procedure has to really understand what's wrong with the patient. And that's where I think a lot of the studies are going wrong, because, you know, if you have a problem And let's say it's with something, let's take something like Achilles tendonitis, okay? And the person has a problem with their Achilles, but their hip's out of balance and their tendon in their knee is problematic. But you may not be able to fix that problem with their knee, with their Achilles, if you don't take care of a problem with their hip or the knee. Just like conversely as well, if someone has a problem with their elbow, I don't think I've ever seen a patient who's had a problem with tendonitis in their elbow who hasn't had a shoulder issue, whether they knew it or not. And you probably see that, Don, too, with people, how they train, that they compensate in different ways during their training, that they start using their muscles in a dysfunctional way because of some unknown injury. And then this repetitive injury creates a problem and starts to tear the tissue apart.
100%. I always like to say X doesn't necessarily mark the spot. You might be feeling pain from that area, but even if we can relieve the pain, or the doctor or physical therapist is able to find relief in that area of pain, unless it was from contact, that pain came for a reason. So we got to find that out. And that's pretty tough for people to digest.
Yeah, and getting back to X marks the spot. With technology nowadays, we're looking for ultrasound and MRI to give us the exact pinpoint location of where something is damaged, and just putting one injection into that damaged area and hoping that it heals. And just because something shows up on an imaging study doesn't mean that that's the only part of the problem. And I think as we rely too heavily on technology and less on our own common sense and diagnostic skills and physical examination skills with our hands and with our brain, that's where I think we can help to solve patients' problems more. Because, some things like injuries, I don't think that they're standard. I think injuries, we can't standardize them because everyone's a little bit different. Everybody's a little different. Everyone's injury is a little bit different. Everyone walks a little bit of a different way. Everyone has a little bit of a different arch in their foot. They take a little bit of a different stride. And because of that, it can lead to different types of problems, even if they're similar, but they're different.
And would you say maybe this works better in athletes because they're just generally healthier, and if they draw that blood out and they have just higher concentrations than somebody who might be like in their 60s with osteoarthritis and not eating well?
Yeah, absolutely. I mean, listen, the immune system of a young pro athlete works amazingly well. And unfortunately, as you get older, your immune system doesn't work that well, especially if you're not taking as much care of yourself as you need to, and eating as healthily as possible, and getting your exercise and getting your rest. So I think that that's a really important thing. But quite frankly, a lot of the pro athletes that I've seen, they must have some type of genetic variation in their immune system that makes them heal super quick. And that's how they've been able to stay in the game and not necessarily succumb to chronic injuries. Because some of the other people that I see, who may be recreational athletes, their immune system isn't as strong and they don't respond quite as well. And, sometimes, it takes several treatments of PRP or several treatments of stem cells in order to get a person better. It may not be an overnight success, but often, treatment is needed and repetitive treatment's needed in someone who doesn't heal 1, 2, 3.
Could it also be a
strategy that I employ?
Could it also be that, a lot of the recreational athletes, they're also, going out and having maybe a couple of cocktails at night, and they're not necessarily as dialed into their diet. And, there's just probably more unhealthy habits like sitting all day long. If you really peel back the layers, a professional athlete doesn't have to sit in a chair for, 6 to 10 hours a day. And that in itself, I personally, I just think it's one of the most overlooked negative things in the average worker's life. Everyone's coming to me or Derek and saying, what do I do to gain flexibility? I'm like, stop sitting as much. It's literally like the first thing I always throw at people, and they all roll their eyes because it's just not what they want to hear. But, I understand what you're saying about, some of these higher level athletes and their ability to perform. But is it that we all know that they're made differently, obviously, because they've gotten to that level, and not everyone can go be a professional athlete. But do you think something has to do with the fact that their lifestyles are maybe, I don't know if I want to say, when I say less stressful, I don't mean they don't have problems in their life, but less stressful in the sense of like not sitting as much, maybe access to better quality foods, maybe they're outdoors more, maybe they're just happier because they're doing something that they love?
I think it could be a combination of all that. Listen, I think our perfect example is Tom Brady, who's one of the most amazing athletes of all time. And look how he takes care of his body, to a phenomenal level. And he's been around forever. He's never really had a long streak of injuries. He bounces back. He's been able to maintain his stamina into his 40s. And I think he's done a wonderful job with his nutrition and lifestyle. So I'm sure that it plays a role into things.
100%.
But listen, back in the day, a lot of these guys were fed nothing but meat and potatoes and junk food. And sometimes they didn't perform as well. And not to pick, listen, I'm a Philadelphia guy, so not to pick on one of my own Sixers, but last year or 2 years ago, Joel Embiid was basically fattening up, and he was doing so on all the wrong foods full of saturated fat and sugars and everything else. And it kind of showed with him on the court and also with his injury pattern. So, and he wasn't bouncing back so quickly, and he just didn't look as sharp on the court to me, even though he's one of the most talented basketball players, in the NBA.
Derek, didn't they have a little special on Lamar Odom years ago? I don't know if you remember that, but they were kind of diving into his daily nutrition, and he was literally eating like gum. And if I'm getting it wrong, Lamar, I apologize. I think it's someone. He was a Laker. I thought it was Odom, but they were showing his diet, and it was it Ron Artest? I'm not exactly sure, but they were showing that like all the guy was eating all day long was candy and gummy bears. But naturally, you can get away with that when you're on the court for how many minutes a night is it? 45 minutes a night, and you're practicing every day, and you're just kind of moving around. But most of these athletes, when their career gets put to a halt, man, it's almost a little scary what's happening to a lot of them within probably that 3 to 5 year span.
Yeah, they fall apart.
Yeah, and it's really tough. Like, the Usain Bolt eating chicken McNuggets, and that's obviously not the reason for his success, but I'm sure that's going to hurt him in 20 years, like having those kind of habits, right?
Oh, absolutely. I mean, listen, unfortunately, you don't take care of yourself, eventually it's going to come and haunt you.
But let me ask you a question about that. And this is probably almost impossible to answer, but you take someone like Usain Bolt, who's the fastest human being we've probably ever seen, right? I mean, right. and this guy, whether his training was conventional or unconventional, it's tough to criticize when you're running the way that he does. And I know Derek's a world-renowned running mechanics coach and knows more about him than probably anyone. But the fact that he was eating chicken nuggets and having a poor diet, I mean, if he was to hire a chef and was to get a higher level of nutrition in his body and a higher level of calories, or maybe just to where maybe the nuggets was making up for this hunger because he wasn't, eating enough earlier in the day, but maybe somehow we were able to change his nutrition to a higher level of nutrition. Does he run faster if nothing else changes?
Well, do you like cars?
Yeah, of course. I love them. Yeah.
Okay. So if you had a Ferrari, are you going to go and get the cheapest regular gas, or you want to put Shell super unleaded in there?
Of course. Of course.
I think that if he put the Shell super unleaded in his body, he's going to perform better.
I believe that also. And I'm confused on why he wouldn't do that. Or was the chicken nuggets thing, Derek, was that just a once in a while thing?
I think what happened was he was in Beijing, and then there's questions around the safety of other foods and contamination and all that. So at least McDonald's was standardized in terms of what they put and stuff, I assume.
Yeah, I would have eaten it also.
Yeah, like they didn't pick up the chickens from the wet market in Wuhan. So yeah, I think that was the story. I don't know if he did that regularly, but certainly in that case, that was an alternative for him.
And maybe it wasn't his regular diet. Who knows?
Yeah. I mean, I think it was yams or something. Anyways, who knows? But yeah.
Right.
So Dr. Greenberg, I got a quick question. I think it was a few weeks ago. I read a recent Wall Street Journal article. It was discussing like your COVID-19 home kit. And I think they put Gatorade into that. And I know now they have like, I think Gatorade Zero or like no sugar Gatorade. Obviously Gatorade always get criticism for sugar, but now you've got heavy sweeteners in this stuff. Did you see that article, or do you, if you were to create your own COVID-19 home kit, like what would it almost consist of?
Well, I didn't see that article per se, but anything that is zero, you just have to be careful with, because if it has artificial sweeteners, that's not really good for you either. And it still heightens the insulin response. And that high insulin is really one of the things that we know that creates inflammation. So as we mentioned before, I think that a beverage like Halo is much better because it's organic and natural, and has natural sweeteners in there, and low calories on a lot of electrolytes. And I think that's a much better way to go. So I think a good hydration drink is important. I think a lot of multivitamins and vitamin C and vitamin D, because they're antiviral properties, I would put that into my home kit. And some of the medicinal mushrooms as well that I mentioned, I would put that into my home kit. Awesome. And, you know, I think that another thing I would put in my home kit is what you specialize in, is exercise. Yeah. And I think that we got to exercise and get outside as long as we're safe, and stay healthy that way too. So I think that's a really important thing to do. So those are some of the things that I would put in my home kit. Maybe some other things I put in too to deal with the stress and anxiety of everything is some meditation and some yoga also, to help to kind of level out a little bit if we're, you know, getting a little bit stir crazy.
Yeah, I'm noticing that. I think the most amount of comments that I'm seeing on social media, at least in the private DMs, are people who are just like, I'm going stir crazy, I'm losing my mind. And I mean, there's such a level of this, like, as soon as this happened, people were so panicked about falling off the cliff, in the sense of like, are they going to lose their fitness? Are they going to lose focus on their goals? I think everyone now, because your priorities are changing, and I noticed it in myself. I think week one, you know, you're definitely craving different things, and you definitely have a little bit of a different outlook. And then, you know, after that first week, I kind of got back on track. But right. When you said meditation, it's just, these are such, I mean, they're free. It's free right. things that we can do. Mm-hmm. Yet people don't trust it. They want to, and listen, I own an infrared sauna in my house. I had a cryotherapy chamber in the city. I believe in recovery, but mm-hmm. I
love cryo, by the way.
Oh, cool. I want to get your opinion on
that. If I work out super hard and you go in the cryo, you feel so much better.
Oh yeah. 2 or 3 minutes, like 3 minutes and you're in and out. But talk about meditation and the ability to relax and cortisol levels, and just how, if you are always in that sympathetic state, we're going to have a problem also, especially our immune systems.
That's absolutely correct. I think you said it, you know, basically, you know, if you're stressed out all the time, your adrenals are just functioning too much. They put out too much cortisol. Cortisol is inflammatory. And then as you have too much inflammation in your body, you know, inflammation is catabolic. It helps to break things down, not build things up, and also suppresses your immune system. So using something like meditation, which is so easy to do, helps you just lower your cortisol levels, lower your stress levels, build up your autonomic nervous system, which helps to counterbalance the sympathetic nervous system. And it's all that yin and yang. We need balance in our life. And just even some simple, like, close your eyes and listen to something calming and breathing and just letting your body settle down helps to strengthen your immune system.
Well, Derek, I know you're in Vancouver. It's a little bit different for you because it's like, that's where they shot Rocky IV, and everyone's, you know, you have the woods and the mountains and all this mm-hmm. stuff, but you can get outside and you can run. But a lot of people in New York City, I'm in Long Island, so I have a backyard. So I'm able to get outside and throw a ball around with my son, and it's safe and there's no one around. But, you know, in the city, I mean, I think we also take for granted sunlight and getting outside and breathing right. in fresh air, doctor. And that can also play, it can almost torment, you know, vitamin D levels, right? And
absolutely.
So are we overreacting by locking ourselves inside, or should we be throwing a mask on and just trying to walk outside and be a little sensible? What's your opinion?
Listen, I think throwing a mask on and getting outside is far better than staying cooped up in your apartment. Number one, for stress. I mean, you're going to be stressed and anxious if you're stuck inside all day. Getting out and getting some fresh air is really good. Interestingly enough, in regards to vitamin D, there was a study that looked at latitude in regards to the COVID infections. And they thought that in areas that are closer to the equator, there's lower rates of infection, lower death rates because of vitamin D from sun exposure. That's one of the things that they've theorized. So again, you got to get out, and unfortunately the weather hasn't been so great in the Philadelphia area. I know you mentioned New York City, but you know, the Philadelphia area hasn't been so great either. But at least if you get outside, it's really good for your immune system to get your body moving. And if we do get those sunny days, got to soak it all in, both for your vitamin D, and also helps to regulate your melatonin, and melatonin is another thing that's important that's released at night on its own. Again, during sleep, it's very good for your immune system and also has been shown to fight virus as well. So why not do everything that you can, especially it's natural, it's free, and it makes you feel good. There's really not a lot of downside. Again, yes, you want to wear your mask if you're walking along Fifth Avenue and there's 20 people out there that are next to you. You want to maintain your social distancing just to be safe. But, I think you have to get out. I think you have to. I think being locked inside all day is just, it's terrible. You atrophy, your brain atrophies, your immune system atrophies. You've got to get out.
100%. Derek?
Yeah. The interesting thing is on the West Coast, it seems like it's less severe in terms of the numbers, the cases, the deaths. I mean, in Vancouver, it's been pretty good, honestly. And maybe it's just the population density, the way it's spread out. But even in California, it hasn't been as bad. I mean, they had the outbreaks in Seattle at the care homes. But other than that, it's been calming down. So I don't know if that is people tend to get outside more, if it's the weather, because we have a lot of people coming back and forth with China on the West Coast. So I found it very interesting.
Yeah, I mean, look, I think some of that could be related to vitamin D levels. And just, that's one variable that we know about. Like I said, they have looked at it and they have studied it, that, sunlight is helpful for increasing your vitamin D, and vitamin D does have antiviral activity to it. So
that's a solid supplement.
I think that's a big part of it.
And that's probably a big supplement for a lot of people to get on right now, right? Like zinc, vitamin D. I mean, we're not really exposed to vitamin D. So are there better sources when it comes to vitamins? I think that's the biggest question. Are there specific, how do you know, are all vitamins created equal in your opinion?
Well, I mean, that's a big question. And with vitamin D, you want to make sure that you have D3 because that's the most active and absorbable form of vitamin D. So, I try to stay away from anything that's synthetic, and it would be really hard to know for the average consumer, what they're getting, but I would look for vitamin D3 in regards to vitamins. And in just picking out a multivitamin in general, I think you want to pick one from a natural brand and one that's trusted rather than something that's, you get off the shelf at CVS or Walmart that has, synthetic things and dyes and colors and fillers and everything else. Those synthetic vitamins, I don't think are as good for you as the natural vitamins. Now, along with that, obviously you want to supplement with a good diet and make sure you're getting all your green leafy vegetables and your colorful vegetables and everything else, and eating those things as well in addition to your supplements, because there's other fibers and nutrients and things like that that are helpful.
Awesome.
So
awesome.
Even if you go, I know we talked a little bit about not drinking too much, but even some red wine has something in it called resveratrol. And there was a study that showed that some resveratrol helps to increase something called the sirtuins in the body. And increasing these sirtuins also was helpful in boosting the immune system, and was actually, they think that this is part of the reason that sirtuin activation is another important factor in the body fighting off coronavirus.
Is that what how's it pronounced? Sirtuin?
Yes, sirtuin. SIRT.
Is that considered an antioxidant, or is that a vitamin? What is that exactly?
I don't think it was really considered a vitamin per se, but I think that they were looking at something that was activated, the sirtuin system that was activated intracellularly. And again, I think the whole concept of all these things has to do with what's called cellular respiration, basically keeping the inside of your cells healthy. And the healthier they are, the more that they utilize oxygen, the more that everything functions well, and your cellular metabolism starts to work, and it basically triggers your whole body to work well and stay with lower levels of producing inflammatory chemicals and producing higher levels of things that help the immune system.
Awesome.
Yeah. So Dr. Greenberg, I think Don and I had talked last week with a guest about this whole idea of like returning back to the sort of normal. And obviously that's being discussed at the governmental level, like how's that going to look? What states are going to open, and how are we phasing back to work? I mean, what recommendations would you be giving to people? Like I've been talking to pro teams in the NBA, NHL, and they're looking at, oh, how are we going to come back? What kind of safeguards are you telling people to implement as part of this return so that we don't have this second wave that might be the next thing to anticipate?
Mm-hmm. Well, I mean, unfortunately, none of us has a crystal ball to know if we can ward off the second wave or not. But, right now, it looks like in one of our, best ways to fight this off may be to build what's known as herd immunity, to where, half the population or more has had some exposure to the virus. And if we are going to pursue a strategy like that as a country, we really want to do so in the population that can tolerate the virus the most, which would basically be young and healthy people, people probably under the age of 60 or 65 who do not have what's known as comorbidities, whether that's obesity or high blood pressure or diabetes or heart disease or any of these problems or autoimmune problems. And maybe get the people who are healthy out into population first. And that may be part of how we do it, in my opinion, because these people are at a much, much lower risk of death. Like me, you, and Don, we're just at a lower risk of death. We take great care of ourselves, and we're healthier, and we're not elderly. So, I think that can help to get people exposure to the virus, which hopefully exposure to the virus means you're not going to get it again. And again, that's another question we just don't have the answers to right now, is could we get it again if we have it? So, but if we get some type of exposure to it, I think that can be helpful. And this also helps us to buy time because, there are pharmaceutical companies looking at antivirals, and these antivirals are showing some promise in early studies. But again, the data is early. It's really early, so we just don't know. And I know that everyone's trying to also look at vaccines, but interestingly enough, I read a whole article today about how they're trying to produce vaccines, and they're looking at producing vaccines against something called the spike protein. And as long as the spike protein doesn't mutate, hopefully this will be a helpful strategy. But in the past, listen, to be perfectly frank, we've struggled with vaccines against the flu and against SARS and against MERS. So who's to say that we're going to have an effective vaccine against COVID-19? We just don't know at this point, is it going to be effective or not? So the biggest things you can still tell people to do to reduce their exposure to it is simple. It's hand washing and not touching your face and not touching your mouth and not touching your eyes, and washing your hands and, avoiding contact, with the virus. Again, that kind of goes against getting herd immunity, but I think that we're seeing right now with all the antibody testing that's being done, that the virus is much more prevalent in society than we realized. And there are a lot of people who are having exposure to the virus that didn't know it, who fortunately aren't getting sick and aren't ending up in the hospital. And that's really bringing the mortality rate of this virus much closer to that than we would see of the flu.
Yeah, that's a good question, the testing piece, because I think I might have had it in February. I had, flu-like symptoms, chills and muscle soreness, and I didn't think anything of it. And we know that it started in China in November, December, and I know there's people coming to Vancouver from there. So I don't know, maybe I have it. I would like to know if I could get an antibody test. But certainly what you're saying is that, I mean, it's kind of all hands on deck. You have to have, the nutrition, the fitness, the hand washing, some sort of drug, some sort of vaccine, but it's all of these things. In your opinion, is that pretty much what we have to do?
I would say so. And, we need a coordinated effort in order to balance out the hospital systems from being overwhelmed versus the life of our people and our economy. And I know that no one really wants to place a dollar value on human life, and I don't want to either. But there comes a point to where, as the economy is shut down, that people's lives start to get impacted in a very serious way with mental health issues and with drug and physical abuse issues and with suicides. And we need to really look at all of these things in order to keep our population healthy and not overwhelm the hospital systems and try to get things a little bit more back to normal as we get better understanding as to what's happening with this virus, because the social toll is a really important thing here. And I think it's something that we can't necessarily ignore. So I think our initial efforts that we've done now have helped to keep the hospital systems from being overwhelmed. And as long as our medical professionals like myself are not getting overwhelmed, which I know in certain areas like New York, they've had a difficult time, but other parts of the country are doing okay. And our area in Pennsylvania is doing okay. But as long as we can control that, then I think that we have to have some percolation back into regular life for people who are low risk. Awesome.
Well, listen, we can't thank you enough for coming on. So this is Dr. Scott Greenberg. Dr. Greenberg, do you have any social handles? Is there anywhere that people can find you if they're interested?
Yeah, we have a Facebook page, and it's Greenberg Regen. I also have a website, greenbergregen.com. And if you go to Facebook, you can see all kinds of interesting things. Actually, we did some fun things since we've been through this COVID thing. My wife and I actually got remarried, and we put on she put on her wedding gown. I put on my tuxedo. Awesome. We kind of recreated a wedding.
Good for you guys.
And my kids, our kids got to participate in it, our 3 children, which was really a lot of fun.
How old are your kids?
Saw this. 16, soon to be 15, and 13.
Awesome.
So so we did that, and I try to put up some medical information on that as well. I put up some of the things about some of the volunteering that we do at a homeless shelter, and even did a TikTok video with my daughter and we were dancing around. So that was awesome. A lot of fun.
Good for you.
I'm not the best dancer.
I'm the worst. I don't know about Derek. Derek, can you move or what? I bet Derek can dance. I know Derek.
I just started a TikTok account, so I got to figure that out. So
you better tag me on that, by the way. I want to see.
Hey, by the way, Don, one thing that's actually always interesting about me, and I showed it, I have a picture of this on my Facebook page, is that when I work out really hard and sweat, my sweat looks like a heart on my shirt from the change in color.
Never heard that before, but listen, that's pretty cool in my book. I think that's awesome. But listen, Dr. Greenberg, we can't thank you enough. Really interesting to hear about PRP. On top of that, just everything in reference to the COVID-19, staying hydrated. I mean, these were all really, antioxidants, everything. I mean, I think it was really a nice, it was a nice session today. So we appreciate it, and we'll be putting the episode up hopefully shortly. And thank you again.
That's great. Hopefully we'll do it sometime soon.
We love it. Thanks. And Scott, Derek, thank you. Scott, thank you very much. Have a good one, guys.
Thanks so much, Don.
Take care. Be safe.
Take care now.